Hey guys, it's Francesca. Okay, this is the second video in my two-part series talking about herd immunity. So if you don't know what herd immunity is, please go and watch part one. I'll wait. Okay, great. So now that you know what it is, we're going to talk a little bit about herd immunity as it relates to SARS-CoV-2. SARS-CoV-2 is the virus that causes a COVID-19 infection. That's the name of the virus. And SARS-CoV-2 is just one member of the coronavirus family of viruses. So I'm going to be using SARS-CoV-2, and if you don't know what that is, now you do. Okay, so let's talk about herd immunity with SARS-CoV-2 and COVID-19. There is a growing movement in the US to reopen the economy. You all know this. And part of the theory that some people are advocating is that if we allow our young, healthy adults and children to go out and get exposed to the virus and get infected with the virus and get antibodies to the virus, they then become immune to the virus, and we can reach the level of 70% of our population having the antibodies that make them immune to the virus. And that's the magic number that experts are saying we would need to reach in order to protect the other 30% of the population who is most vulnerable and has not had it. So this is the thinking behind the idea of COVID parties, right? People think just like with chicken pox, okay? When I was a kid, parents would send their kids over to the house of a kid who had chicken pox so that their child would get infected with it, because we knew that when you got chicken pox as a little kid, it tended to be relatively mild, and the older you were, the more likely it would be a severe infection. We also knew that chicken pox, once you had it once, you could never get it again. And so this is what parents would do before we had a vaccine. So some people are using that same logic with COVID. They're saying kids and young people are very unlikely to get severe illness, so just let them get exposed to it, and that way it's done with, and that way, it's also helping to prevent other people from getting it from that kid. Some people are also looking at Sweden, where they never did a lockdown and they've just made recommendations for the population to follow. And their death rates actually generally have been lower than a lot of other countries, and their economy has been able to continue functioning. So those are sort of some of the arguments for reopening and letting people just do whatever and allowing herd immunity to happen naturally through getting the infection. There are a number of concerns with this theory, okay? First of all, we don't know that the antibodies that a person gets from having the infection automatically mean that they're going to be immune to this virus forever. We don't yet know if this virus is going to behave like chickenpox, where you get it once and you never get it again, or if it's going to behave more like the seasonal flu, where it will be changing each year, and just because you've had it once doesn't mean that you can't get it again. It's too early for us to know which of those it's going to be, and so the idea that we intentionally expose ourselves to make ourselves immune, it's a little premature to make that decision, okay? So that's the first concern. The second concern is that, when we talk about chickenpox, millions of people got the chickenpox every year, but the death rate from chickenpox was very low, like 100 to 150 per year in the US, okay? This virus, SARS-CoV-2 and COVID-19 infection, this virus is killing around 2,000 people a day right now. It's already killed more people in 3 months than the seasonal flu usually kills in 6, okay? So we can't just make that comparison between those two. And as far as Sweden goes, first of all, there's a new study that shows that the percent of people who have antibodies to the virus in the beginning of April was only around 7%, in spite of keeping their economy open and letting people interact well with social distancing recommendations. The researchers estimate that that means that maybe about 20 to 30% of the population has antibodies now. Still kind of a far cry from 70%, which would be needed to reach herd immunity. Also, Sweden is a very different country from the US. They have a lot less Black people, they have a lot less people with Latin American backgrounds, and frankly, they have a lot less people who are overweight and obese. And we already know that those three groups are at much higher risk for having severe complications from this virus. So, you know, we can't make an automatic comparison between Sweden and our country. And then the fourth concern is that as of right now, antibody studies that are being done in the US suggest that maybe 3 to 4% of the population has been exposed to the virus that have the antibodies. In some places like New York City, where we had such a huge surge of cases, it's still only around 15 to 20% of the population that have antibodies. And meanwhile, 1 out of 500 New Yorkers died from the virus. So 3 to 4% of the US population maybe has been exposed to the virus. And we've had 96,000 people die from it. In order to get to 70% of the population being exposed to the virus, a lot more people would need to die. And let's not just talk about deaths, right? We know that a lot of people are taking weeks to a month to recover. A lot of people are ending up in the ICU. Young people are having strokes. Children are having this inflammatory syndrome. And all of the, you know, some of those things are rare, but because the number of people who are being exposed is so big, the actual number of people who are getting those things is large enough to be, you know, making the news. So this is why, you know, public health experts are recommending that we continue social distancing, and that we may need to keep, you know, we may need to do lockdowns periodically until we either get treatments that are really effective or a vaccine that allows us to achieve herd immunity without requiring millions of people to get infected. All right, I hope this is helpful. I know it's a complicated and for some people emotional conversation, because this is hard and it sucks. It just does. So please take good care of yourselves. If you have questions, let me know. I will be sharing more videos going forward, and yeah, just stay safe, guys.